Alright, so I have scenario one, Francis Michaud. He was admitted into the USM hospital with a small bowel obstruction. He is NPO and has an NG tube in place on low intermittent suction. So for the past 4 hours, he has lost 600 milliliters through his NG tube, and his serum potassium levels are 3.2 milliequivalents per liter, which is too low. It needs to be at least 3.5. So we're going to go address that. We're going to go give him the maintenance fluids and replacement fluids, and then afterwards we'll address whether those are the right fluids to be giving. Hi Francis, how you doing? Pump in. I'm Brett. I'm going to be one of your nurses today. So right now I'm just going to get you 2 things of fluid going. So I'm just going to make sure you're having enough. I'm going to touch a bag to your IV to make sure you're getting enough fluids for your day. Make sure you're getting enough electrolytes, potassium, and sodium. And the other thing I'm going to be doing is attaching another bag to replace all your losses through your NG tube. So what that is for is to replace the fluids that you are losing and to replace the electrolytes that you're losing as well. So I'm just going to assess your band, and then you want to just confirm your name and date of birth for me. Awesome, happy birthday. So I'm just going to assess your IV site real quick. Alright, we're going to assess his IV. So I'm going to put on gloves. So just looking at it, you can see his name being there as well. We'll just refer to this picture as well. So we don't see any swelling, there's no arrhythmia, the vein is not popping out. Is there any pain with this at all, Mr. Michaud? Okay, so no pain. So it looks good. There's a little bit of blood, but that's okay. So now we're going to address the pump. So we have our maintenance fluid and our replacement fluid. So these are all set up. We're going to set this up 90 milliliters an hour, which is what the order says. We're going to set this up at 150 milliliters an hour. I'll explain that later. So we just want to make sure these are the right things. So we have the order, 90 milliliters an hour for the maintenance, D5 normal saline, we got D5 half normal saline. So we could just go back, check. Awesome, those look perfect. So we have those are all set. So do you want to just reconfirm your name and date of birth for me? Awesome, that looks good. Happy birthday again. So we have that. We've got the right route, right patient. We have the right time as well. And do you have any allergies at all? Nope, no allergies. Awesome. Alright, so we'll get these pumps running, and then we'll go and check whether these are the right medications or not. Alright, so now after getting all those medications running and everything, we're going to check to make sure he's getting enough fluids, enough potassium, and enough sodium. Alright, so the fluids. So we'll adjust the maintenance fluid. So our order is a bag of D5W, half normal saline at 90 milliliters an hour. That's not enough fluids. That is going to come out, so 90 times 24 will come out to 2,160, which is enough. We just need to make sure we're between 2 liters to 3 liters. Is that enough sodium? That will be enough sodium, and we know that because half normal saline is going to give you 77 milliequivalents per liter. Now we just times that by the amount of liters we have, which is 2. So 77 times 2 is going to come out to 154 milliequivalents per liter. And that's awesome. So that will be enough. We just need to make sure we're above 100. Now, is that enough potassium? No. We're not getting any potassium in our maintenance fluids. Now, is that the right fluid? It is not, because we know we're not getting enough potassium. Now, we know it's the right rate, and we're getting enough sodium. We're not getting any potassium. Now, because he is post-surgery for a small bowel obstruction, it is fine that it is hypertonic. Okay, now for the replacement fluids. So we have the order for 1 liter bag of D50 half normal saline with 20 milliequivalents of potassium chloride for a 1:1 milliliter replacement every 4 hours. Now we knew that he lost 600 through his NG tube. So what's the rate for this? So we need to replace a 1:1 ratio every 4 hours. So we need to replace 600 milliliters over these 4 hours. So it's as simple as this. Comes out to 150 milliliters an hour. Now, is this the right fluid? This is the right fluid. This is a great fluid for NG replacements. And it's great to make sure he's getting the sodium, because he will be losing acidic fluids. So we need to make sure he's getting this instead of LR.